When evaluating the neutrophil morphology, it's also important to look for intracellular organisms within the neutrophils. Here is a characteristic example of anaplasma, formerly known as Ehrlichia. Anaplasma typically appears as clusters of purple dots with intracytoplasmic vacuoles in the neutrophils. This infection has recently been renamed from human granulocytic ehrlichiosis to human granulocytic anaplasmosis. Morphologically, the clusters of purple dots, or so-called elementary bodies of anaplasma, resemble the mulberry and are often referred to as a morula. Other nonspecific laboratory findings associated with human granulocytic anaplasmosis include a leukopenia, thrombocytopenia, and elevated levels of serum transaminases. Clinical manifestations of anaplasmosis are similar to other tick-borne illnesses, including Lyme's disease, borreliosis, and babesiosis. These infections are more severe in the elderly and the immunocompromised patients, and there are also reports of co-infection of anaplasmosis and other tick-borne diseases. Anaplasmosis is generally seen in the Northeast and the Midwest, and is caused by the organism Anaplasma phagocytophilium. Serologic and molecular tests are available for confirming this diagnosis. Of note, ehrlichiosis is a different disease caused by a different organism called Ehrlichia chaffiensis, and is primarily seen in the southeast, south central, and mid-Atlantic regions of the United States. The morula of Ehrlichia are found in the monocytes instead of in the neutrophils. As you could imagine, these intracytoplasmic organisms can often be overlooked, especially in the context of a low parasitemia burden. Further complicating these types of smears, the clinician is often not looking for anaplasmosis when he sends a peripheral blood morphology. So the diagnosis of anaplasmosis is often made incidentally, since the serologic and molecular tests available are much more specific and sensitive for the diagnosis. Here's another example with one neutrophil showing intracytoplasmic organisms and the remainder of the neutrophils showing toxic vacuolization, a key finding in anaplasmosis.